Almost every family eventually enters the maze. A parent gets dementia. A stroke happens. A fall changes everything. A diagnosis nobody saw coming. And suddenly, the conversation in the room isn't about philosophy anymore. It's about paperwork. But most people just don't know it yet. A hospital room, machines humming quietly. A man is 58 years old. He's had strokes, heart attacks, diabetes. They've already taken one of his toes. His speech is slurred now. His hand trembles as he tries to hold a pen. Across from him sits a clipboard. 8 pages. Small print. Deadlines. Eligibility questions. Legal language. The man can barely speak clearly, but the system needs him to fill out the paperwork. Because before help can begin, he has to prove he deserves it. This is MT Promises to You. That moment right there is when people discover something about the American safety net. It isn't really a safety net. It's a maze. Programs like Medicaid, Medicare, and disability through the Social Security Administration exist for a reason. Because illness happens. Strokes happen. Lives fall apart. And when that happens, a civilized society says, we will help. That's the promise. But the help sits behind something else. Forms, documentation, appeals, eligibility thresholds, asset rules, medical records, deadlines, layer after layer of process. Here's the contradiction. The system is designed for people who are organized, alert, persistent, legally literate. But the people applying are often sick, confused, injured, impoverished, or alone. So the question becomes obvious. If someone is too sick to work, how are they expected to work the system? And that's where something strange happens. A new industry appears. Disability lawyers, consultants, case navigators, appeal specialists, entire professions whose job is not healing people, but navigating bureaucracy. Think about that. We didn't just build a safety net. We built a maze so complicated that you need a professional guide just to reach the net. Now, billions of dollars move through systems like this every year, not just to patients, but to administrators, compliance departments, legal teams, consultants, people managing rules, people interpreting rules, people enforcing rules. And none of them are necessarily villains, but the structure itself creates something strange. The more complicated the system becomes, the more people make a living managing it. Meanwhile, the person the system was designed to help is lying in a hospital bed, unable to walk, unable to work, sometimes barely able to speak. And the answer they receive is simple. More paperwork, more documentation, more waiting, more proof that they are broken enough to qualify for help. When people talk about fraud in systems like this, the conversation usually points downward. Who's cheating? Who's taking advantage? Who's getting benefits they shouldn't? But the debate misses the deeper question. Because the biggest structural problem isn't at the bottom. It's the maze itself. The poor don't run the system. The sick don't run the system. The people filling out the forms don't run the system. The system runs them. And if help requires navigating a maze, then the people who need help the most will always be the ones least able to reach it. And one day, almost every family discovers that. A stroke, a fall, dementia, a diagnosis nobody expected. And suddenly, someone you care about needs help navigating a system they cannot possibly understand. And that's when the real safety net shows up. Not the paperwork, not the program, people, family members, friends. Sometimes the one person willing to step up when everyone else disappears. And the truth is, that person might be you. Even when it's hard, even when the relationship isn't perfect, even when the past is complicated. Because in the end, this is still how America works. When life knocks someone down, somebody else stands up. The maze may be real, but so are the people who help each other through it. And that might be the most important promise we still keep. I am MT. This is MT Promises to You, because I am done with all the empty promises to you.